We'll quickly move to the next type of muscle diseases. So this one is like a broad classification. It's called inflammatory myopathies. Do you understand? So under this classification, you have other type of muscle diseases. You understand that kind of thing? So they call it the inflammatory myopathy. Okay. So of course, the word inflammatory is like there's an inflammation. You know, the myopathy is the condition is to the muscles. You know, so inflammatory myopathies, they're actually a group of rare chronic muscle diseases. So they are characterized by muscle inflammation and weakness. So it's often caused by what? Autoimmune mechanisms. Okay. So what are inflammatory myopathies? They are acquired muscle disorders where the immune system mistakenly what? Attacks muscle tissue. Okay. So this leads to progressive weakness and sometimes pain. Okay. So this condition can affect both children and what? Adults. Okay. So what are the examples? So we have things like the polymyositis. Poly means many. Okay, inflammation of many muscle types. Okay. So you have Dermatomyositis. Okay. It's a condition that affects the muscle, skin, blood vessels. Is both inflammatory and degenerative. Okay. Then we have the inclusion body myositis. Okay. So that one, if you do on histology, you see inclusion bodies in it. Then we have the necrotizing autoimmune myopathy. Okay, severe weakness, elevated muscle enzymes, a lot of things. Okay, so generally, okay, the issues such patients will have is muscle weakness. They have difficulties in doing high activities like climbing stairs, lifting objects. Swallowing too becomes an issue. Muscle pain or tenderness, skin changes. You can have weakness, I can have weight loss. So diagnosis, you do blood tests, just to pick up some 1 or 2 ions, okay, look at their levels. Electromyography, you are trying to see how the muscle and the nerve are still maintaining activity. The muscle biopsy, then sometimes MRI, we are trying to image and see if there's any issues, okay, structurally. So treatment is, since you are dealing with an inflammatory condition, you give anti-inflammatory drugs, right? An example is corticosteroids. Then most of those conditions is the body's immune system that is kind of like attacking the body. So you give drugs that will help to calm down the immune system. Methotrexate, azatropine. Okay. Then intravenous immunoglobulin G. Okay. Then physical therapy is just to maintain how the body is still moving at that time, that part, and all of that.